my name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफी फर्क आ रहा है.
Okay. I actually had this surgery in the back and you said I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Shiraldin from Bangalore.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You are able to speak words properly and sentences properly.
Just you try to say something.
Treatment is in there. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist, and today we are live and today we are before treatment live, and with us Hideshan is here and he's having some voice problem, and in the future we are going to be post treatment live also, so please subscribe our YouTube channel and don't forget to watch Hideshan's post treatment live. And today date is 16th of June 2021. Hideshan, I want speech sample before starting the treatment. What exactly problem you are facing?
Hi, sir. So the problem that I'm facing is that my voice, the pitch of my voice is slightly higher than average. So I would like to reduce it as much as possible. That's just the problem that I'm facing.
Okay, so what are the challenges you are facing because of your pitch problem?
It's just in general, let's say, lower levels of confidence, and sometimes people mistaking in, let's say, random telephone conversations and all that. So that's the issue.
Okay. So I will talk in little bit in Hindi also. There are some people those will understand Hindi. So नमस्कार दोस्तों, आज हमारे YouTube चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पे स्वागत है। और हितेशन को वॉइस की समस्या है और इसकी वजह से इन्होंने कांटेक्ट किया। आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं और आज डेट है 16th of June 2021 एंड इन द फ्यूचर हम लोग भविष्य में पोस्ट ट्रीटमेंट लाइव भी जरूर होंगे और आप लोग हमारा YouTube चैनल सब्सक्राइब कर लीजिए ताकि इनका पोस्ट ट्रीटमेंट लाइव देख सकें। और हितेशन इंडिया में नहीं है, ये डिफरेंट कंट्री में है, तो आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं। और मेरे यूट्यूब चैनल के कमेंट बॉक्स में बहुत ही कॉमन क्वेश्चन आते हैं, योर कॉन्टैक्ट डिटेल्स. सो फॉर कॉन्टैक्ट डिटेल्स प्लीज रेफर द डिस्क्रिप्शन ऑफ दिस लाइव वीडियो एंड यू फाइंड द कॉन्टैक्ट डिटेल्स. And there is one more complaint also, like we are not picking the phone. So because of the COVID pandemic, our clinic was closed, and recently we have opened from last 2 days. And now till now from 9:30 to 12:30 we'll be able to pick your phone calls, and because of our staff will be going back to home because till 2 o'clock it's allowed to open. So please refer the description of the for the contact details, and feel free to call us. We'll be picking, especially between 9:30 to 12:30 we are able to pick your call. And to anytime communicate, you can email us and just leave your contact details. And sorry. Yes, Hiteshan. So tell your hobbies, what you do during free time. I want more speech samples so that people can hear your voice.
Hobbies include I just research a lot on stuff such as I like researching on the 5 elements, what they say, ether, air, and fire, water, and earth, and all that. So I try to put in pieces together, and I also research a lot on politics. But then you could call me apolitical. So I'm not very much. I don't participate in politics at all. I don't vote. I don't encourage anyone for that matter. But then I research a lot into it, and then I also research a lot into psychology, and then a little bit of astrology as well. So that is in general my hobbies, and then I also like walking out in nature as well. So that is those are pretty much my hobbies, and then I also like playing chess. That's another one.
Okay, thank you. And now we'll be discussing a little bit about why this problem, and we'll also include some other communication disorder in our discussion so that people having some communication disorder, they can watch this live and they can get idea and they also think about the solution available. So let's understand.
Why I also want for I'm okay with the live as well, because let's say I found your YouTube channel and someone else actually volunteered for the live. So someone finds my video, let's say, motivating or whatever, then they can, they'll find it useful, and then they'll be motivated to come and fix whatever they as well. So hopefully if mine gets fixed, then someone else will get motivated,
Yeah, thank you. So let's discuss about the normal speech production mechanism. Just for awareness, I'm going to talk. You can switch off your mic. Okay. So for normal speech production, first thing is the thoughts. So I will try to correlate communication disorder. Once you know the normal, it will be easier to understand what is abnormal and why it is abnormal. So let's first understand normal speech production mechanism. For normal speech production mechanism, first thing is the thoughts that comes in the brain. And then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cords. So once you put air pressure below the vocal cords, here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds will generate. And then we modify that sound into different sound with the help of our lips, tongue, jaw, teeth, palate, known as articulators. For example, if you want to say p, both the lips are coming closer together and touching each other. When you want to say t, tongue is coming between the teeth. When you want to say k, back of the tongue is getting elevated and touching the soft palate. So each and every sound has its own place, own manner of articulation. If place will be wrong, manner will be wrong, there will be communication problem. We call it misarticulation, mispronunciation. Sometimes it may be related to the hearing issues also. So we do first hearing evaluation also in such situation, and try to understand the exact reason. And there will be another issue, the place of articulation will be wrong, manner of articulation will be wrong. For example, if you want to say the, tongue should come between the teeth and you are putting tongue somewhere else, the sound will be different. So that comes in the pronunciation issue. So when you say one sentence, in one sentence, there are so many words. Each word has so many sound. Each sound has own place and own manner of articulation. So when we say a one sentence, so many things happen at a time. Thoughts comes, we take breath, we put air pressure below the vocal cords move, sound generate, we modify that sound to different sound, one after another, because in one sentence, so many words, in each word, there are so many sound, each sound, its own place, own manner of articulation. So it's quite complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, there will be some fluency issue that will be reflected in the form of a stammering or a stuttering. I have seen in such patient. There will be lagging the coordination among the speech production muscles with the brain. So that will be a case of a stammering. So let's talk about the voice problem. So there are some voice problem where the pitch and the loudness will be the problem. There are some voice problem, there will be breathiness, there will be some voice problem, there will be hoarseness. So let's discuss why the voice will be the hoarse. I'll come to the pitch issue also. So we have larynx here. Inside the larynx, two string-like structures we have. And both the vocal cords, when vibrate, they will be vibrating in the unison. Suppose in one vocal cord, some mass develops, for example. So this vocal cord is vibrating in a different frequency. This vocal cord is vibrating in a different frequency because the pitch depends upon the mass, length, and the tension both. There is an acoustic formula I was talking during the assessment session, and it's equal to 1 by 2L under root T by M. So, like if any string vibrates, the frequency also depends on the mass of the vibrating string and the length of the vibrating string and the tension as well. So, like two vocal cords, suppose in the vocal cord there is a polyp developed. So one vocal cord will be having different mass and this vocal cord will be having a different mass. So both the string will be not vibrating in the same frequency. They will be not be in unison. So there can be hoarseness. So if a cyst develops, that case also, and even the vocal cords are not vibrating effectively. Suppose everything is fine, it's a functional problem. Vocal cords are normal, and but both are not vibrating in effective manner. Both are vibrating in a different frequency, so they will be not be unison. So that time also hoarseness can be seen. So saying hoarseness doesn't mean that only particular ABCD problem. A problem only. There can be B, there can be C, there can be D. So proper assessment is very, very important. I have seen the hoarseness in the puberphonia also. I have seen the hoarseness in the vocal nodule also. I have seen in the vocal polyp also, in the cyst also, laryngeal cancer also. So being a professional, we do patients first perceptual evaluation, and then if it is required based on the history and all, then we suggest some test called stroboscopy and laryngoscopy. And so even I have seen the spasmodic dysphonia case also, the hoarseness, even the vocal cord paralysis also, there will be hoarseness. So I was talking about the vocal cord paralysis. So let's understand, this is also now it's called, many patients are coming after the COVID. So in the vocal cord paralysis, there may be sometime infection will be also there, bacterial infection, viral infection, and sometime traumatic injury, and sometime during the surgical procedure, if the nerve which is supplying the vocal cord is getting damaged, there will be some hoarseness and the breathiness, because there are two vocal cords. Suppose if right vocal cords nerve which is supplying is getting damaged, so right will not be moving. So when we speak, both the vocal cords should come closer together. And if this is not moving right one, so left one is coming, but there is some gap will be developed and a lot of air will pass. So the loudness will be not be sufficient, because the air pressure which we are creating the vocal cord, that is the creating the energy to vibrate the vocal cord. And if the lot of air is escaping due to the phonatory gap, so the loudness will be not be there, breathiness will be there, and because of the paralysis, one vocal cord will vibrate in a different way and others will maybe vibrate or may not vibrate if it is a partial paralysis. So they are again not in unison, so hoarseness will be there. So this I was talking. There are some certain functional problem. I have seen very interesting patients in my clinic, but those are very rare. Functional aphonia. The patient's vocal cords is absolutely fine, but because of the laryngeal tension and because of some psychological reason, there will be complete absence of voice. There will be no voice at all. We call it aphonia. Aphonia means absence of voice, and it's very interesting to treat, and its result is quite impressive in our center. So if you will explore, those who are watching this live, our YouTube channel playlist, you will be able to find some functional aphonia patient. Even one guy from Africa came, and there was one doctor, and there is one more girl. So you will be able to find it. Just explore that. It will be very interesting. Like patient is without any voice, and then once he achieved, they will start crying and all. You can watch that. Once he called that African boy to his mom. He was, I think, 12, 13 years old. So he started crying and also. Have you seen?
Wouldn't they?
Yeah, so that was really very emotional moment, and we have catched that moment. One of my team member catched that emotion, and with their permission, we have uploaded also. So I can say that there are lots of communication disorder, and many people don't know also how to manage, and they think, suppose if a fever is there, and if you go to a physician, they will be trying to find out what is the cause of the fever, and based on that they will give the best treatment. But some healthcare quacks, they will see the prescription of the physician and they will try to copy that. But if the reason will be different, it will not be helpful. The same thing happens in our field also. Sometime because of unemployment, there are some healthcare quacks, they will go to some speech therapy clinic with the relatives, they see what he did and try to implement all the patient. So even the pitch is higher, the high pitch voice is there. The high pitch can be due to so many reasons. Sometimes the phonatory gap also creates a high pitch voice. I have seen in some patients muscle tension dysphonia also. In case of sulcus vocalis also, where now nature has not given the sufficient mass and the length, and some cases, of course, the vocal cord mass and the length is sufficient, but they are not using the vocal cord in an effective manner. That case also can be there. So the common situation is like where the mass and the length of the vocal cord is normal, but they're not using in effective manner. So with our perceptual evaluation acoustic analysis, sometimes required, we suggest for the laryngoscopy, try to find out the exact reason, and based on that, we start the treatment. So I'm just going to discuss the situation where nature has given the sufficient mass and the length. So let's go in the detail. As I told in the beginning, how the normal speech production mechanism. So in that I was talking, here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once we put air pressure below the vocal cords start moving like a string of a violin and guitar, and the sounds generate. Then we modify that sound into different sound. So during puberty, what happens, because of the testosterone hormones, in case of boys, the mass of the vocal cord and the length of the vocal cord increases. So if mass will increase, length will increase, pitch reduces. You can also correlate with the guitar string. Like in the guitar string, if the string is thin, the pitch will be higher. But when the guitar string is thick, pitch will be lower. So before puberty, our vocal cord, in case of boys, is like a thin string of a guitar. But during puberty or after puberty, because of the testosterone hormone effect, it becomes thick string. And thick string means what? The pitch should be lower. But because of so many years habit, for example, the boy has spoken from childhood to puberty in a high-pitched voice. During puberty, the mass got changed, length got changed. It's ready to produce the low-pitched voice. But because of their so many years habit, they will not accept the change which has happened during the puberty and the new voice. So they will try to maintain their childish voice because of so many years habit. Some reason, slightly we can say the psychological also. In the beginning, but later it's become vocal cords are not vibrating effectively. So if they will not accept the new voice to maintain their childish voice, vocal cord is thick now, but they want to maintain the childish voice. So what they will do, that they will just vibrate the thin edges of the vocal cord instead of vibrating the whole mass and the whole length of the vocal cord. Okay, so once they will vibrate only thin edges, so vocal cord which is actually thick but behaving like a thin string of a guitar. And if guitar string is thin, the pitch will be higher. So what I will do as a voice therapist in such situation, and what I do exactly, I try to stimulate the areas of the vocal cord which are not vibrating effectively. So once I will stimulate whole mass and the whole length of the vocal cord, the pitch reduces. So even a very simple way you can understand, in the guitar, if you want to change the pitch, what you will change? The string, not the big box. Big box is the resonators, our oral cavity or uvula and those areas, that is not very important for the pitch. For the pitch, important thing is the vocal cord. Like in a guitar, if you want a high frequency or low frequency, which thing you want to manipulate? The string, not the big box, not the resonator. So here also we try to work on the vocal cords. And vocal cord is important, and I don't think uvula or the palate is so much important in such situation. If we stimulate, even see, I'm sitting in my home and I'm trying to stimulate the vocal cord mass and the length in a more effective manner. And after sitting, you can see online therapy from last 1 year, so many patients we have treated. So what I'm telling, it's matching what I'm doing. Okay. And so what we do in the voice therapy, suppose if only thin edges are vibrating, we'll stimulate whole mass and the whole length. So the vibrating mass will increase, vibrating length will increase. The vocal cord, which was behaving like a thin string artificially, now it will start actually like a thick string, what exactly it is. So once the guitar string will be the thick, the pitch will be lower. So the same thing happens. So after therapy, sometime it will be quite impressive. Suppose one patient is coming with a pitch of 250 Hz, and once I treat, they will say, "Sir, you are not a speech pathologist or a speech therapist, you are a magician." But the reason is that why the change was big, but he was having a very high pitch. But there is a patient who is coming with a pitch of 170 Hz. So if I'll bring at 150, the change what I've done 20 Hz, so the visible change will be comparatively less. but we put effort from everyone. So I don't replace the vocal cord. And what I do, what you have, I train to use in a more effective manner. And sometimes patient will be having tension in the vocal cord while talking, putting a stress, and also I teach them to talk in most relaxed way. So I'm not like a guitar maker. Okay, I am
I wish
just
I was.
I train how to use that guitar. You can say I'm a guitar teacher. When it's very simple way to understand. I'm not making the guitar. Okay, some patient will be saying that. I remember many patient once they will call on the phone and they will try to discuss with me sometime. Sir, I have seen the Manjunath voice. It was so impressive in your YouTube channels. I voice like a Manjunath. To get the voice like a Manjunath, I'm just giving example, XYZ name. You should have the vocal cords like Manjunath. Being a speech pathologist, even many of my patient, even some patients are RJ also in the radio, RJ in the Gujarat, in the some Ahmedabad radio FM. So even being a speech pathologist, I can't make my voice like many of my patients. The reason their vocal cord is different and mine is different. So if I will be trained myself also, there are certain limitation what I will achieve. So what nature has given the vocal cord mass and the length, that is also important. How nicely I am giving the training, of course, that is very, very important. And how nicely the patient is just accepting the instruction, following the instruction. If I am telling something else and the patient is having always the doubt, maybe he is cheating or something is wrong or something. So in that case also it may be not be very effective. So most important thing is the patient should have the motivation, faith, and the dedication, and he should follow the instruction. So I have seen the good result in such situation. And I'll be looking just a little bit on the questions which I'm getting now. Then also, and before that, I'll just for awareness I'll tell for our contact details. Please refer the description of this live. And if you have any communication problem, so first step is we do the perceptual evaluation, and depending upon your communication problem, we then comment about the expected outcome, treatment duration, expected result, and cost, etc. So first thing is the perceptual evaluation. If required, sometime we suggest some test, and after the test report comes, then we comment on the issues. And what kind of services we provide to understand that, explore our YouTube channel playlist. You'll find so many playlists and different communication disorder. And that will give you an idea how a certified speech language pathologist can change the life of people having different communication disorder. You will find in our playlist vocal cord paralysis patient pre and post treatment videos, sulcus vocalis patient pre and post treatment videos. You will find functional aphonia pre and post treatment videos. You will find stammering patient pre and post treatment videos. You will also find misarticulation, mispronunciation pre and post treatment videos. You'll find stroke patient and they develop aphasia, and then we give the language therapy and speech therapy, how the communication improve. And even you will find spasmodic dysphonia pre and post treatment videos, phonatory gap. So you'll find so many like videos pre and post. Even in fact, I'm an audiologist and speech language pathologist about both. So after hearing inclusion, when we recommend the patient hearing aid and we put the dispenser hearing aid, and after fitting the hearing aid, how the patient communication improved, that also there will be some videos. So you just try to explore our YouTube channel playlist and you'll get an idea. And let's now discuss any questions, and if it is there. Yeah. So thank you everyone for joining. Here I can say that Nisanka Bandra, thank you for joining. Suraj Gautam, thank you for joining. And Sabina Sheikh, thank you for joining. Nisaka Bandra, thank you. Ranjit Thakur, thank you for joining. And Mahesh Waran, thank you for joining. Sagar Ran Paria, thank you for joining. Ranjan Singh, thank you for joining. And Harsha, thank you for joining. Stalin, thank you for joining. So let me discuss about the now. So Nishank Bandara is saying, help me. Yes, Nisanka, please refer the description for the contact details and please communicate with us and we'll help you. And Sabina Sheikh is saying, hi sir, please send your address. So our address are there in our website, and website link is also given in our description of this live. So please refer the description of this live for our website and other contact details. And Ranjit Thakur is saying hello. Hi sir, namaste. Hello Ranjit Thakur ji. Hi. And Sagar Ranpriya is saying hi sir. Hi Sagar. And Sagar is saying I am Sagar from Gujarat. Thank you Sagar for joining us. I am in Bangalore. Thank you for joining and watching. And Ranjan Singh is saying sir ऑनलाइन थेरेपी कब से? अब जब से है, लेकिन पहले आपका परसेप्चुअल इवोल्यूशन करना पड़ेगा रंजन सिंह जी, कि आप जानना चाहेंगे कि आप ऑनलाइन के कैंडिडेट हैं या ऑफलाइन के, तो इसके लिए हमें कॉल कीजिए. आप ईमेल भी कर सकते हैं विथ योर कॉन्टैक्ट डिटेल्स एंड देन वी विल सजेस्ट अकॉर्डिंगली. Sagar Rampriya, you are perfect, sir. Thank you. I am not perfect, but I am trying to learn more and more with my patient. So Stalin Gamer saying hi, sir. Hi, Stalin. वो स्टालिन बोलते हैं सर हिंदी में बोलिए. ठीक है, आप हिंदी में क्वेश्चन पूछिए. आपका क्वेश्चन क्या है? मैं जवाब दूंगा. मैं हिंदी इंग्लिश दोनों में बोल सकता हूँ. Sir, stammering can be managed by online speech therapy. Yes, Harsa, we have seen some good improvement by online speech therapy also in case of stammering at our center. So you can contact us and we'll do first perceptual evaluation and then we'll accordingly guide you. And Sandeep Sirsat likhte hain, hi sir, send me contact details. So Sandeep, please refer the description of this live for the contact details. And at our website, you click the reach me and you'll find all the email ID and the phone number, and in the Google map where is our clinic situated. And Lishan Udip is saying, sir, can I directly contact you through the contact number? So of course contact number are there, so you can call us. So our team will contact you because I'll be mostly in the therapy session, so it is very difficult to pick the phone. For that there is a different team. So Ranjan Singh is saying, sir, online. Of course, Ranjan Singh, we are giving online and offline both kind of speech therapy. But after the perceptual evaluation, we decide who is candidate for the online therapy or who is not for online therapy. Samir Patel is saying, hi sir, I am from Canada. Hi Samir Patel, thank you for joining and watching us. सर मुझे भी ऑनलाइन थेरेपी करवाना है, क्या करें? तो सागर जी कांटेक्ट कीजिए फॉर परसेप्चुअल इवोल्यूशन, देन विल बी एबल टू कमेंट ऑन योर इशू. स्टालिन जी, सर मुझे प्यूबरफोनिया है, इसका इलाज ऑनलाइन. स्टालिन जी, आप ही डिसाइड मत कर दीजिए कि आप प्यूबरफोनिया है, तो हम क्या करेंगे? मैंने बताया था कि पतली आवाज़ जो होती है सल्कस वोकल इसमें भी होती है, मसल टेंशन डिस्फोनिया में भी होती है, फोनेटरी गैप में भी होती है, टेस्टोस्टेरोन हार्मोन की कमी की वजह से भी होता है. तो आप मत डिसाइड कीजिए, हमें डिसाइड करने दीजिए. फर्स्ट विल डू द परसेप्चुअल इवोल्यूशन and then we will be telling what kind of problem you are having. If needed, certain tests we can recommend. And Samir Patel likhte hain, if I join, how you will allot time for? Samir, first we'll do the perceptual evaluation. The first thing is you are a right candidate for the online therapy or offline therapy. We need to understand. If needed, we'll suggest some certain test, laryngoscopy, and after that one we will be able to connect. We will be able to comment on the issues. So first, let us decide what kind of communication problem you are having. Please call us for perceptual evaluation. And yes, you can call us and we'll discuss in more detail. And so thank you, Samir, for joining us. And thank you, Stalin. Thank you. Thank you everyone for joining and watching us. And Hitesh Pandyan, yeah. Now you can tell again what exactly problem you are facing and why you contacted.
Yeah, so like I said in the beginning of the video, I feel that my voice has a slightly higher pitch than average, and I would like to reduce it if possible. That's why I reached out to you through your website.
Okay, thank you so much, Hiteshan, for supporting me for making this live and creating helping me to create
I
awareness
think
about the
you are on
communication.
mute, sir.
Oh, sorry.
I'm not able to hear you. Is it
Sorry, it was
me?
mic was muted. So thank you for joining with me for creating awareness about the communication disorder. And those who are watching this live, please subscribe our YouTube channel so that you can watch the post-treatment and pre-treatment both the live. Anyway, pre-treatment already you are watching, so you can watch the post-treatment live as well. And you also can just press the bell icon so you will get notification will be when we coming the next live. And you can also explore our YouTube channel playlist, those who are watching this live, so we'll get an idea what kind of problem we solved with the voice therapy. And we'll stop this live if there will be no new questions because yeah, so I'm again getting questions. Sir, I have a stammering. Of course, in the stammering, we have seen speech therapy helps and the treatment efficacy is 80%. Like when 100 people comes for the stammering therapy at our center, we have seen good result or significant result. We can say that in 80 people, and 20 people think it was a wastage of time and money. So you can contact us and we'll do the perceptual evaluation and we'll guide you. Yeah, so Samir, our public relation officer will be helping. I think a lot of questions you have, so you can email us. Our email will be at our yes. Yeah, so you can again call us. I think this is very personal thing, and we can discuss about the time and all. And for my public relation officer will be helping you, Samir, please. Yeah. So personal information, appointment, and all. My public relation officer will be helping to you. So if you have a question, so you can directly mail us, and in the mail by the mail we will communicate or you'll talk on the phone. So Samir, for your suggestion is that you can contact us on the phone. And thank you everyone for joining and watching. If any new questions are there. Yeah, those who are having any inquiries related to the appointment, so I think you can mail us and directly do the phone call again. And Hemant Puri is saying that, sir, how many days course? So Hemant Puri, the duration depend upon the kind of communication problem the patient is having. So first we do the perceptual evaluation if needed. We suggest some tests and then we comment. So thank you everyone for watching. I think there's no new question, so we'll stop this live. So thank you, Hitesh. Thank you so much.
Thank you so much, sir.